Okay, today we are so lucky to have seven siblings, six siblings of adults with Down syndrome to talk to everybody about their journey with their sibling as their adult sibling grows older, and the plans that are in process or the plans that have already happened that will guide them along the way as they take over care for their sibling. So we've created a list of questions that we will be asking all of the panelists. You can recognize the panelists because their names have their sibling's name right next to them. So they'll have two names. Everybody's going to get a chance to answer the questions that we provide, but you have a chance to answer questions, ask questions as well at the end. So we're going to save our questions to the end. And I think that's about it. These siblings were asked, because all of you are either siblings or parents, but I want you to know that they were asked because they're all at different places on this journey, and they all have adult siblings of different abilities and who need different kinds of supports. So I was trying to grab a panel that was representative of different places, different ages and different stages, as they like to say at the Down Syndrome Association. You're going to hear from their answer to their discussion questions that some of them are in the middle of this journey too. Some were more prepared for this when they started with the care for their adult sibling, and some were not prepared at all. And I think the basic underlying message is everybody does it their own way, and there's no right or wrong way to do it. But we wanted to put this together to kind of give you some thought points to guide you as you start taking over the care of your siblings. So without further ado, I would like to introduce to you this, or have the siblings introduce themselves to you. And we're going to start with Kat.
Hi, everybody. My name is Kat Papkin. My sister's name is Karen. We are 3 years apart, so I am 36 and she is 33. The cat that was sitting behind me is named Nico. Hopefully he'll come, he won't decide to just jump on my lap. He has a bad habit of jumping on my lap in the middle of a Zoom meeting. So if he jumps up and I disappear for a second, that's why. Um, Debbie, do you want me to talk for a couple seconds just about sort of what my journey has been, or do we get into that with the questions?
I think we'll get into that with the questions, if that's
Okay.
okay. Okay. Courtney?
Hi, I'm Courtney Fishman. My sister is Carrie. She's 46 years old, and we have another sister in the middle of us Kim, who couldn't be here tonight, but she was planning to be here but got caught up with something. But she and I are really partners in this journey with Carrie.
Thank you. Wendy?
Hi, nice to meet everybody. My sister's name is Nancy. She is 59 and approaching year 60 very within a couple of months. So it's been a long journey for us. I'm almost 80 years old, so my concerns center around both of those sets of ages. We'll talk more as we get to know each other.
Thank you. Will?
Hi, everyone. My name is Will Sanborn. I have three sisters, two of whom have Down syndrome. Allison and Julie are identical twins who both have Down syndrome, and they are 34.
Thank you. Joan? You unmuted and then muted again.
If you're on a computer and you just hold space, it'll unmute you.
don't know why we're not hearing you.
Do you maybe have ear pods or a headset that was hooked up earlier? Maybe still hooked up?
Joan, to take the heat off you, I'm going to go to Nick and then come back to you, but maybe if you mute and unmute again, I always say start over. So try to mute again and then unmute.
You want me to go, Debbie?
Yeah.
Jeez. My name's Nick Regan. My brother's name is Tim. He's been living with us on and off for 2 years. He's 38. And yeah, I'm sure we'll get more into that, but
Thank you. Joan? Do you want to go out of Zoom and come back into Zoom again? Okay. I'll let you in.
is that yours?
Yes, yeah, this is my son.
Wow.
He she's not back. So yeah, but he's got to learn all this too because he's got 2 uncles and an aunt with Down syndrome, and he's eventually going to need to know all this stuff. Okay, until Joan comes back, I think we're just going to get started. I don't see her. So the first question actually is for Will and Nick, and this is the question that we're going to start with. How does your sibling fill the day? Will that be sustainable in the future if the sibling is not living with your parents? Well, and Nick, in your case, not living in the same
Currently.
setup. Yeah. So, Will?
Sure. So currently, both Julie and Allison live at home with my parents. Home for my parents is in Gates Mills, and they attend a day program up at the Help Foundation up in Euclid. And so every day, Help provides transportation that picks them up and drops them off, between 8 and 3. And they have a wide array of day activities there that they really enjoy. A little bit of work, some trips and outings, and recreational activities at their program. And then they come home, and other recreational things they enjoy include swimming. They've done therapeutic riding in the past, and hopefully that's something that can continue. They love the theater and walking and coloring and puzzles and watching movies. And so my parents have really done a nice job to kind of fill their recreational time to the best that they can. In about a month, they are going to be moving out of my parents' home into Solon Community Living, which is a new residential village that is being built right now down in Solon off of Aurora Road. And it's a facility that they're very excited about. And I believe there are still some slots available, but they're kind of some of the founding members there. And we can kind of talk in as we go throughout the evening about how they're going to kind of help support their services, as well as other things that my folks still need to address and bring to the table as well. But they're really excited about that. So that's going to take place in just about a month if construction stays on schedule. What else? So and there's a little interesting tidbit about will that be sustainable? So something my parents have filled me in on is that they hope that in moving now that they have to go from Solon up to Euclid, their daily commute to and from the program, if they were to stay, would increase. And so it's going to lead to a conversation about if keeping them at Help in Euclid is the best fit, Interestingly enough, Health Foundation has just opened a second, another location, I should say, down off of Emory Road, which would be a little closer to Solon. So the question at their home right now is, do you make all that transition at once? The answer is probably not all at once. So let's do the move and then kind of explore if that is the program that they're going to continue with, because they are very happy at Help Euclid. And so it's interesting that as soon as one opportunity presents itself, then there's a whole list of other things that you kind of make adjustments for. So that's going to be one of the questions on their plate, is what's going to be the best fit for them moving forward. But they are very excited about their move, and I think everybody, my sisters and my parents, and are excited for what's upcoming.
Thank you.
Yeah.
Nick?
Yeah, so Tim 3 to 4 days a week works with or goes to a program called Out and About, where they go to different activity. They pick them up either from my house, I live down in Hudson, or my parents' house, which is up in Moreland Hills. And they'll pick him up and a couple of other adults with differing abilities, and they go all around to different activities. And so he does that, and then outside of those activities, I pay him to go on walks, and he also walks dogs in the neighborhood. Outside of that, we try to include him in anything that we're doing as a family, whether that's going out to eat, going to parks, going to visit somewhere. And then, is it sustainable? Yeah, I mean, it's been kind of one of those things where we're trying to include them in everything. So I don't see any reason why it shouldn't be sustainable.
That makes sense. Thank you. And Nick, his brother Tim is living with him right now, so he's already made that big transition.
I can go into that. So my parents are avid travelers. Tim just needed a little extra help and whatnot, and so when they're away, he comes and stays with me and goes back and forth. And so we're kind of in that transition zone of, is this gonna be a permanent thing, or we kind of leave it up to him where he wants to be. And away from my mother is usually the answer. So it's not just you, Debbie.
Thanks, Nick. I'm going to interrupt for a minute. Joan, you're on now.
Yes.
Yay.
I apologize. I'm the technologically challenged member of the panel. And yeah, my name's Joan Barno, and my sister Mary is 55. I'll pass it back.
Thank you. Thanks. Okay, my next question actually is yours, Joan. You're from a larger family with several children. How do you and your siblings make your decisions for Mary? Is this everybody gets a vote, or you get the vote and they have to follow? Do you have to okay it with them, or it's just unilateral, you're in charge?
Basically, I'm the only sister in town. I have two brothers that aren't that helpful. My reliable siblings are both out of town. One's in Boston, one's in Chicago. But to use an example, I recently had, we were trying to make a decision about whether to try this one kind of chemo drug on Mary. So I knew it was be a lot of information. So I made a voice recording out of the doctor's phone call and emailed it to everybody, so they could just listen to the whole thing, get all the information, and then they can all email me back with their input on things. So the information kind of filters through me and I spread it out, and it's a group decision for sure.
Do you ever get pushback on any of those choices?
My two brothers in town usually do very little to help choose things, but then are the first to criticize the selections. But I've learned to just kind of accept that and move on. But I don't usually, no, usually everyone's in agreement that, you know, at the end of the day, we did the right thing. But yeah, I definitely don't just take charge. She has siblings, everybody should get a vote. So that's how we do
Okay.
it.
All right, good to know. Will and Wendy, you're up next. Have you had to advocate in day programs? So we all have hit glitches in programming for our loved ones with Down syndrome or with whatever, you know, these glitches come up. How do you address any glitches that come up on behalf of your sibling? Will?
Sure, I can answer at I can actually answer this on a couple of different fronts. I'll kind of explain the unique connection I have to folks with IDD, but as a sibling to my sisters, I have not had to do that yet. But I know I would confidently do that I know it will present itself moving forward, especially as my older sister and I become more involved with my younger sisters trajectory. Currently, my parents are still very involved, but I know that things will change. My mother is also a sibling to someone who has IDD, and so her lifetime has also been part of this journey from a sibling perspective. And she shared with me that she has had to advocate for all sorts of medical and programming needs that her brother has needed through the years. And so she says that those days will come. And then professionally, I know some know on the call and some will not know that I managed the adult employment program at DSANEO. And so that puts me on the other side of the table when I have individuals and families advocating on behalf of their loved ones and for what they need in the workplace. And so I hope I have been responsive to the needs of our families and the individuals we serve, but I've also witnessed from the other side of the table that just simply asking for what you need and asking for what would be possible, what could be possible, that always opens up a conversation. And I know that you know, as a professional hoping to provide the best work experience for our individuals with Down syndrome, I'm always happy to see if we need an accommodation or if we need an adjustment to do everything I can to make that possible. And we have made, we've tweaked the way that we do the workday or provided resources or just explored kind of the best way to communicate with folks so that they can have success in the program. And so I hope I didn't disturb the multiverse too much, but I've come at it as a sibling, the child of a sibling, and as somebody who, you know, works to serve folks with Down syndrome professionally. I would say always ask for what you need, be the squeaky wheel, and because you never know what you can get to ensure that success for your person.
I think, Will, if you're not aware, they're not all like you. They don't always like accommodate because you ask and are so nice about it and so willing to help the person where they need the help. So that's why that question came to my mind when I was developing questions. Thank you. Wendy?
My experience is probably quite a bit different from everybody else. When my sister was born, since she's close to being 60 years old, most of the advice that my parents got was that she wouldn't live long enough, and a variety of things like that. My mother was the stubborn person, like Will was politely describing, and insisted that Nancy was mainstreamed in school education, which is how she met Debbie in the first place years and years ago. So you told me, which I
Yeah,
didn't know.
yeah,
And since
50
then,
years ago.
she graduated from Mayfield High School, and after that, my mother just was very insistent that she get a job, and so she did. She ended up at Menora Park and put in a little bit more than 30 years at Menora Park and retired. She actually was a wage earner. So that makes us very, very proud of all of that accomplishment. The thought process behind all of that is my parents were in their 40s when they had Nancy, and so their concern was that they would not outlive her, and wanted to be sure that she was in such an environment and status of herself that she would be as independent as possible. So the other exciting part of that whole story and journey is that Nancy lived in her own one-bedroom apartment in Menora Park for a good 20 years, which was great because she was working right there on the campus. We did have care staff that came in to assist her with things like a little bit of grocery run, little personal errands, that sort of things. Then when she did retire, she engaged in one of the adult day programs that are there at Menora. At least they used to be. I just learned Menora Park has been sold, so it's no longer Menora Park. So who knows what all changes have taken place, but Nancy enjoyed the day programs and it was a new experience for her. And then along came COVID, and that undid quite a bit of things because we ended up keeping Nancy living with our mother because that's where she was when COVID struck. And because of that and the up and down rulings from the state, she could not return back to Menora Park without going through a 14-day what was the word that they had everybody in?
Isolation.
Isolation. Thank you very much. Just knew that Nancy wouldn't do that. She's a people person. She likes to be out and about, and they closed the dining room. You'd have to use the phone to place your meal order. We knew that wasn't going to work. We didn't know at that point in time whether any of her care people would be allowed in the building. They hadn't, they were quick to shut things down, but they didn't have the rules out there. And we also didn't know if the care people would want to be in the building. So we opted to keep my sister at home. Of course, everybody knew at that point in time that the whole virus and illness would be over within about 6 months, right?
Yeah.
Yeah, which we all know that didn't happen. Right now, my sister is in a group home, so it's a completely different journey and phase of where she is. So I think the important thing was to what my folks were worried about was making sure that Nancy was as independent as possible as they faded out of the picture. And each of her siblings, we were all living in other states. So it wasn't like there was somebody like Joan and some of the rest of you are on the panel who are right nearby. So I ended up moving back to Ohio to be here. So we
Wendy,
have a
when you
different,
first
slightly different journey.
when you first contacted me, she was working at Menora Park, but she was starting to display some difficulties based on her age and memory status. Did you have to intervene with what was going on there to kind of make things easier for her or for the people she was working with?
Bits and pieces. I can't say enough if you're not already engaged with your county's DD people. You need to be in bed with them. They've got some tremendous folks there. Through them, we ended up seeking assistance from the University Hospital's Foley Elder Health Center, the neurologist and psychiatrist there. We did start her on some memory medication. The employers, though, at Menora, they prided themselves on having a department that was all kinds of folks that needed additional support. So she didn't have a full-time job. It was maybe close to 30 hours a work week. They were very easy to work with. They monitored each of the people, the various kinds of handicaps or developmental disabilities, and saw that they were adjusted as needed. We seldom had to speak up some of the areas that we did speak up was a little bit more vacation time, or um, she's starting to balk at some of the movements, arm movements. She was folding laundry and stuff, and we wanted to make sure that that wasn't causing health issues. And they were very, very cooperative. We would just have a conversation and sometimes go in and meet with them. And that's important. It's like the others have said, you just need to be that advocate, try to put yourself in your person's shoes as well as the employer.
Thank you. All right, Catherine and Wendy, all of our people with Down syndrome and other disabilities have some non-negotiable behaviors or non-negotiable routines that they like to do. And by non-negotiable, I mean like, this is how I do it, this is when I do it, and I will not be deterred from that. So they may, or those routines may or may not fit in to the changes that they're going to experience when they move in with you or with somebody else, or their health changes. So how do you manage their odd behaviors or their non-negotiables? Catherine, you had mentioned a few things about Karen when you and I first spoke.
Yeah. I think this is the hardest question actually, because this is the one I don't really have a solid answer for yet. I'm very much still in the progress of this journey. So Karen lives at a ICF facility. It's called ViaQuest. The specific house she's at is Walton House. It's about 15 minutes from my home, which is wonderful. Everyone there has been great with her. She really likes living there. She has her staff that help her 24/7. They manage her medications, they manage all of her sort of daily living activities, food, toileting, all of those details. I think for me, Karen has some sort of mental illness on top of the Down syndrome. We don't really know what it is. We haven't really been able to get any answers. I've gotten several different guesses, but no diagnosis. And she sometimes sees things or is interacting with a world that like is just not there. She'll talk to herself, but like she's talking to somebody else and she'll get very, very angry. And during those periods, she will kind of like lash out at the people around her. Um, she can also just be very, very stubborn. If she gets it in her head that she doesn't want to do something, then we're just not doing it. So I mean, the way we've really dealt with that is by being flexible for her. Sort of rolling with the punches as it comes. She has actually hit a couple of her housemates. And that was very, very challenging. I'm very, very grateful to the people at ViaQuest who've been able to work with us and, come up with some alternative suggestions and ways that we could manage that behavior. We've tried a bunch of different medications. I think we've finally found the balance of meds that is actually working for her. And she hasn't been talking to anybody else who's not there recently, so no news is good news. But yeah, I don't really have a great answer. A lot of it is, I think, we're just trying to be as accommodating as possible and trying to redirect whenever we can. But some days she gets it in her head that she wants to go outside and she just leaves the house. And that's something that staff are aware of and that they are just kind of dealing with. And to be honest, I think this is the primary reason why she doesn't live in my home with me. Like I just was realistic and admitted that I was not prepared to deal with that level of difficulty and frustration. And that was a really hard decision. I talked it over with my husband. I talked it over with my mom. It was a really, really tough decision, but I didn't see a way for me to be living with her and dealing with that on the daily. So a lot of it for me is, I can be much more patient because I see her a couple times a week rather than every single day.
I appreciate that authenticity. Thank you. Wendy?
Catherine and I are going to have some private conversation. I can tell right away. I need to learn more about what you've been, how you found ViaQuest, et cetera. My Nancy is also in an ICF. She's in with Gateways. She's in Youngstown. So when I do go to see her, I'm an hour plus drive over there. From what you described, I'm certainly not a medical person, but I'm easily going to say, look into the Alzheimer's. You're probably already doing that. One thing that I've become more sensitive to, that even non-developmental disabled peoples that get into Alzheimer's, I think they fall in two categories. There's either the nice, meek and mild, gentle person that we all know, or there's the others that are very angry and there's something going on. And I don't know that the medical community has a way to define or decide which is which, and which side of the fence you're on until it starts getting displaying. There's a Facebook group that I think Deb had already kind of has mentioned. I can't not emphasize that enough. I have learned so much from joining that Facebook group. It's Down syndrome and Alzheimer's. And I'm just thoroughly amazed at some of the situations that people are going through and some of their experiences. Some of the loved ones are in their young 60s, but and just reading some of the problems and things that they're going through. Some examples that may fit with what you're kind of sort of talking about. Last week, the person was fine with hygiene and showering and a bath or whatever. And all of a sudden, bam, 3 days later, nope, we're not doing any of that. And not only are they not doing any of that, but it's not going to change either. And that's part of some of the symptoms that other folks have been stumbling into. The only thing that I can suggest, and it's the same thing you're already doing, is be flexible, be open-minded about it. I'm also a hospice volunteer, although I haven't done it that actively recently. But one of the things that they always stress is if you're working with somebody that or supporting somebody with Alzheimer's, you step into their world. You don't try to explain, no, the sky is not purple green, it's blue. Oh, that's a lovely shade of purple. What do you think about that? And go that route. It's because you're not going to be able to bring your loved one back into the same mental focus that you were in. I don't know if that helps any or not, but
That's
those
well
changes for
said.
all of you with siblings are going to be coming your way. And I guess my huge message to I can't emphasize enough, you need to think towards the future, getting your person as independent as they possibly can. I highly applaud what Will and his family are doing, because I'm aware of that Solon setup. Have kind of watched it, and it's Nancy's too beyond what they can provide. And I wish we had a lot more of that kind of thing that's out there.
Thank you. Nick, you had a few ideas you wanted to share?
I forgot I muted myself. I'm in a little different scenario where I have two younger children who don't understand Tim's non-negotiables all that well. So Tim's big non-negotiables are he only eats meat. He doesn't take his phone anywhere it can't be charged. And then he self-talks. His inner thoughts come out, and sometimes can be a little bit vulgar. And the way we've coped with it is, one, just explaining that that's the self-talk with my children, is that's just him thinking. When you think in your head, he's just letting it out. And you know, a lot of times when he's doing this, either just let him be or ask him if he needs help. And that has helped. And actually, he has a pretty good connection, especially with my daughter. Um, on she'll ask him a question and it'll break him right out of the self-talk, and he'll um engage with her on those things. The food thing, he sees the kids try all different things and he'll try them. He went from only eating meat, and I've now got him eating grapes, corn soup, grilled cheese, rice. Um, and he'll see the kids eat it. He'll see the kids enjoy it. He'll also see the kids spit out food and laugh about it. And um, that I think that that has helped. And then the phone chart, the phone thing, and this one, and we actually got him a watch, an Apple Watch, that he didn't correlate with the phone having to be charged in, and it worked. It recently got stolen, so that needs to be rectified, but it worked. I could get a hold, he could go on his walks, he could go as far as he wanted, and I could see exactly where he was and contact him. And so it's really just being flexible and thinking about ways to work around some of those non-negotiables that they all come with. We all come with.
Yeah, theirs kind of stand out a little bit more, but I like the way that you both accommodated and encouraged without forcefully trying to change him. You know, your kids are encouraging more negotiable behavior. I like that. Okay, moving on, Nick and Courtney. Courtney, we finally get to hear you. I'm so sorry you've had to wait so long. Your families, again, have multiple siblings that can potentially care for your sibling. Have you talked to Carrie or Tim about who they prefer to live with when the parents are no longer around? And then, you know, if so, where would he and she prefer to live and why? I think Nick, you're first on this one.
Okay. So we've had the conversation, and Tim will choose anyone who he's not with currently. But
Sounds right.
it's an open discussion. Right now, so I'm one of 6 siblings. And 2 live out of town. And Tim lives with me and my parents, and then the other 2 have some very young families and growing families. So right now I'm the best option. And that can change in the future, and we're open to that. But for right now, we have a spare bedroom that he uses, that is his apartment, and that's why he's here. But if things were to change or he wanted to go somewhere else, I think we'd all be open to that decision.
Would he be comfortable talking to you about moving to somebody, another brother?
I don't know, because I know a lot of like a lot of the back and forth. Like I said, like this isn't permanent, him living here yet. Um, because I think that there is a lot of, he doesn't want to hurt my feelings or my parents' feelings by saying I don't want to live with you. So a lot of it's like reading his behavior, or I know that there have been times where I've really made him mad and he wants to go. But then he'll do something and I'll be like, all right, you're going back to mom and dad's, and his behavior stops. So those are the things I read where he says he's really what he's saying and what he's meaning are 2 different things. And you just gotta kind of be open to it, and then also what's right for your family. That whatever works out best for, for everybody.
Courtney.
Hi, everybody. So we're in a somewhat similar situation to Nick. So my sister Carrie, who's 46, she currently lives with my mom. And our other sister Kim and I, we all live very close to each other. We're all within 10 minutes of each other. Carrie has stayed with Kim's family. She has stayed with my family. And we're lucky that it all works. And so we're in an open discussion right now about what will be the best for Carrie in the future and when that future comes, how soon it comes. And we are actually, I don't know how many months ago, we started, Carrie sees a psychologist. And now my mom, Kim, and I meet with a psychologist without Carrie every few weeks to problem solve and plan and kind of talk about what we're going to do, how we manage her now, and how we're planning for her future, and what's going to be the best case scenario for her. I think what Nick touched on is, what works for each family is different. And Kim and I both love Carrie tremendously and want to make sure her needs are met, and, that it's going to be a good plan for our families as well whenever she joins in with one of our lives. And it might be a fluid situation as well, like if something's not working out.
Do you plan on giving Carrie a voice in where she wants to go? Although I know Carrie and she would probably be afraid of offending either one of you.
That is absolutely true.
Yeah.
I think that the good news about that is that we can all manage those conversations, and my mom at this point is helping with managing those conversations. And Carrie can say what she prefers. And yeah, we're a team, and we're gonna figure out what's best for her, including her voice.
Including what? I'm sorry.
Her voice.
Okay.
What she wants.
Yeah. Thank you. Catherine and Nick, you live in a different county than your sibling did. Catherine, your sister started in Youngstown, and I'm saying Catherine, but it's Kat. And Nick, you're in Summit County, right? And all of Tim's services started in Cuyahoga County. So do you have to do anything special to coordinate with the boards, with the, Summit in Cuyahoga and Portage, I think Youngstown is in? Their boards of DD to make everything work so that services from one county go to the next county? And I think this time it was Kat, you were first on that one.
Yeah, so that's a spicy nugget. So I grew up in Youngstown, near Youngstown, small town near Vienna. My sister, well, I'll give you the whole story, I guess. So my father passed away when we were both young. He committed suicide, and my mom was sort of unable to deal with the stress of that fact and my sister and just daily living. So she had a breakdown. And she ended up in a facility for a while. She's since sort of gotten back on her feet a little bit, but for, most of my high school career, she was away. And my sister was living with a nice lady named Betty. We found Betty through the county DD board. She was supposed to just be a respite provider, and she ended up becoming Karen's full-time care provider. And she was Karen's full-time care provider for 20 years. And so I was sort of out of the picture for the most part during that whole period of time. And when I came into the picture, things had sort of escalated. Karen was very sick. She got aspiration pneumonia and ended up in the hospital. And so the transition period, like I'd already been talking about maybe transferring her out to be near me. I live in Cuyahoga County. She was in Mahoning County. I'd already been sort of trying to figure out how to transfer her. And once she went into the hospital, it was clear that like there wasn't really a place for her to go back to. So that was when we finally made the transfer. And it was a process. And it was partially a process because her waiver was also in question. So the waiver goes through the county. And usually if they transfer counties, their waiver comes with them. But because Karen was going from an independent living situation with a waiver to an ICF situation without one, that was very, very complicated. So I spent a lot of time on the phone with her SSA in Mahoning County and her SA in Cuyahoga County. I don't know why they're two different acronyms. I've learned so many different acronyms and jargon and all of this nonsense to try to make this work. They each had their own separate IEP and like their own separate forms for how things were done. It was very stressful and very complicated. But we did eventually get her like moved and taken over. And I think that just goes back to the advocacy portion. It was just, you know, me on the phone saying, hey, we have to figure this out. Like you guys continuing to have her waiver while she's in Mahoning County, while she's living in Cuyahoga County, and her waiver is in Mahoning County is not an acceptable situation. We have to figure this out. And that's really through sheer force of will was how I managed to get it to happen. And they've told me that they've since standardized things a little bit more. Like each of the counties is now using a standard form that like the entire state uses. So maybe that would help in future. For my purposes, it actually made it more complicated because now we had 3 forms. We had Mahoning's, Cuyahoga's, and the state one that they were both moving to, but they hadn't filled out yet and didn't know yet. So yeah, it was a mess, but we did get through it and we did get the transfer to happen. I don't know that I can give any more advice than just keep being the squeaky wheel and be persistent.
It's disheartening how many hoops you have to jump through.
Yeah.
And Nick, from
Yes.
Cuyahoga to Summit,
So we have not switched him over yet, because he goes back and forth. And so we have contacted his SSA, to let her know what the situation was, and she said just leave him in Cuyahoga County until it's official that he's staying here, or if he's staying here. And then we'll kick off that process, if need be. But as of now, he still goes through Cuyahoga County Services.
that's helpful.
Yeah.
Okay, moving on, Joan and Wendy. So your siblings, you do not have them living with you, your sisters. So how did you find the options for them to live away from you? Where did you find the list of possible residences for Mary and for Nancy? Joan?
We got very lucky, because Mary was doing some rehabs in a couple different nursing homes in Parma she broke her ankle and it healed, but she still wasn't, she refused like 5 physical therapy teams to stand up and walk. And there was just this disconnect of that she needed to walk. She just wouldn't. So, luckily we had a pretty good SA with the county, and she, figured out for now we needed an ICF, which right away I'm like, well, what is ICF now? You just have to keep learning all these different letters and what they mean. And she, used the old portal, the county portal. And luckily these two, a nurse and the manager of a house run by Blossom Hill came to see us in the nursing home to see if Mary would be a viable candidate for the house. And she, they wanted to know if she had behavior issues and all that. So they approved her, and then we went for a visit and saw the house, and She did an overnight stay, and now she's been there about 6 months. And the plan all along growing up was that she was going to live with me. But, you know, you say that with such, I really did mean it, but then she got older and the regression started, and then the ankle break, and she has to be Hoyered everywhere. And, you know, I'm trying to picture how it's going to work in my little house. So, you know, it's heartbreaking to have her in this home, but I'm probably there 6 days a week, you know, hanging with her. And they're wonderful. I mean, everyone that works there is just some of the kindest people I've ever come across. And for the most part, she's, you know, she's as happy as she can be. She's regressed a lot in the past year, just amazing, the difference. But I guess my long answer for that short question was we got lucky with that portal. Somebody saw Mary's name, and you know, they had a couple openings at the house, and they came and found us, and so far so good.
Thank you. That was lucky.
Yeah.
Wendy?
I think our experience has been similar to what Joan went through and also Kat went through. Your SSA, your essay is so key to not only explain what the various services are, but being an advocate to help you find and search out when Nancy went through the broken leg and all that stuff too, and the nursing home. And I was considering leaving her there because she was content and people liked her, but there wasn't any activity, no stimulation. So it was important to go ahead and move. And at the time, ICF seemed like it was the best answer. I don't like her in Youngstown, but that's another whole story. But I hope all of your listeners are gathering that things that you may think are good intentions and are working well today, try to project yourself out just in 6 months, maybe even 3 months, and be able to say, well, what if my person does some of the things that I just heard about tonight from this panel? You need to have that future look-see in any plan that you make, because that change will happen quickly and it'll happen overnight. Like Joan said, you're seeing a lot of regression. With my Nancy, she's almost I use the term zombie like right now. She's not communicating. She's not on any kind of heavy duty medications. We're trying to figure out what's going on. Seizures have now shown up. And I understand again through that Facebook group that seizures are fairly commonplace as our person's age. The other major thing that I wrote down here is any kind of change to that person. Nick, you're starting to see a little bit of it. Change is far more dramatic to our loved ones than we can ever imagine, because we're capable of being pretty flexible with our own changes in our own lives. They just are not. They slip and slide and sometimes just even kind of sort of shut down a little bit. So keep all those thoughts in mind, because it will sneak up on you, and then you'll be going, oh my gosh, now what? Besides the fact that each of us are also aging. And it can be a kind of a rough combination.
Thank you. That's such an important point.
The only other thing I would add to that, I'm sorry to interrupt you real quick.
Okay.
When I was working with the Portage SSA when we went from Cuyahoga, and when I first moved her, she was in with my mother in an independent assisted place in Aurora area, and then the nursing home for the rehab for her broken leg. One of the comments that I kept getting from the Portage County people were, be wary of doing too much in the direction of Summit County, because most of their focus is Akron, and there isn't that much available up in our area where all of us live. I'm in Twinsburg. Nick, you're in Hudson. So you have to look at that too, is where are the resources. Cuyahoga apparently has a lot of resources. That's very helpful. Mahoning was not exactly a choice that I went after, but the ICF was available. Gateways has something like 15 different houses that are there. Other than that, I was kind of getting the runaround between Summit and Cuyahoga as to what ICFs they had. A number of them were closed because they either had repairs to make, and so they had bundled all the people together in one house. And then when they did get the repairs fixed in the other house and started rebalancing the people, the residents, then they didn't have enough staff to hire. So you got a lot of other things to think about besides what you would think is just the real obvious. But I
I
don't know if
just
that
want to
helps
throw
anybody
in
or not.
and reiterate that I also noticed a huge difference between Mahoning County and Cuyahoga. Like just the SA or the SSA in Mahoning was just so overworked. And it was so obvious that she was overworked and she was trying, but like she had too many cases. Whereas like once I started working with Cuyahoga people, the biggest struggle was actually getting an SA. Once I finally got my foot in the door and got set up with somebody, the person I worked with was fantastic. And she seemed a lot more knowledgeable, and there were a lot more options and resources available in Cuyahoga than there were in Mahoning.
That's good to know.
So I kind of agree. I think, Nick, if you can, keep him in Cuyahoga as long as you can.
So in terms of some of the legal things, managing the waiver, Medicaid, the rep payee, the SSI, all those things that are integral to maintaining our folks. If they're not in ICFs, they need the Medicaid waivers, they need their SSI support, SNAP benefits, who manages all that? And Will and Nick, I'm going to put you two in that question because there a lot of I call it my time suck is renewing all those benefit programs for my two kids with Down syndrome. And so who manages that for your siblings? Or who will manage that? Now if once your parents are no, I know your parents do it now, and Nick, your parents probably do it now. Who's going to do that when they're gone or out of the picture and unable to?
I did not know the answer to that question before I asked my mom, and she let me know that part of their, plan and thinking ahead, that's partially realized at this point. They hope to have more fleshed out pretty soon. Involves a team beyond my sister and I. We will obviously be involved, but we are very fortunate that it's not going to fall entirely on us for their legal needs. They have a great relationship with Janet Louder. I know a special needs attorney that many in our community have worked with. They also have a financial manager that kind of covers the things like the trusts and whatnot. And then I'm sure they have more answers than they've shared with us so far. But I know that these are things that they're still trying to figure out because as so many of us are probably aware, our siblings' lives are so hands-on with the parents that it can be difficult to let go, but it's so important to make that transition when times are well. So these are questions that my sister and I are beginning to ask, and it's harkening back to when we were adolescents and asking questions that my parents weren't excited to answer, but they know that they have to answer some of these questions. As far as I've heard so far, that there is a team of professionals that can then help advise us as to what to do moving forward.
That's a really good point, that we have to do all this transitioning to this while we're still alive and able to guide as parents, able to guide that. Nick, what about in your family? Will you be taking care of all of that recertification renewals?
So as of right now, yes, my parents take care of all that, and they actually have it all spelled out legally. And I believe currently I am set up to be that person, and I'm starting to be a little more involved in terms of when they meet for the ISP and other meetings with SSA and all that stuff. So yes, the answer is me.
Thank you. Catherine and Joan, so did you have to become guardians, and do you become guardians while your parents were alive, after your parent passed on or passed the reins over in your case, Kat? How did you do that? And how did you make that decision on whether to become a guardian or just power of attorney or whatever? Kat?
So again, my story is a little winding and weird. When Karen was a minor, Betty did have guardianship of her. But I didn't know at the time that that expires once you become an adult. I sort of just assumed that that would continue in perpetuity because she clearly needed it. So I actually was working under the assumption that Betty was her legal guardian and had been for years. And then I started getting a bit more involved and I talked to her SSA, and her SSA said, yeah, Karen really needs a guardian. Like, she's still signing all of her own paperwork. And I was like, what now? You're having my sister, who can barely write her own name and definitely doesn't understand what any of this means, sign her own paperwork to consent for medical like stuff. So I actually talked with Betty and I offered for her to do the process and become the legal guardian. And she said she didn't want it, that she was getting older herself, that she kind of felt that her time with Karen was drawing to an end. And so there wasn't really much of a question for me. There was nobody else it could be. I don't have any other siblings to lean on. My mom clearly was not able to do it, and so it kind of had to be me. Um, it was kind of scary, honestly, because it was a big step. It felt like a huge step because like I'm legally responsible for this person that had only been tangentially involved in her life before that. I talked it over a lot with my husband. He's been very, very supportive. Um, as far as the actual process goes, it was not that bad. I did hire a lawyer. It turned out you didn't really need one. You can definitely do this on your own. It felt weird to do it on my own, so I hired somebody. Um, they had there was a training session online, which I actually did find very, very helpful. They walked you through all of the legal requirements. My husband had a lot of questions about like what we were on the hook for, quote unquote. Did this mean that we were taking on her financial debts, for example? Did this mean that, if she were to hurt somebody, that we would be responsible? And the answer to all of that is no. But I kind of had to learn how that worked and what the process looked like. So the actual process was just a hearing. I showed up in court. I invited pretty much everybody. I made my mom come. I made Betty come. I made the people from Gateways, actually, because Karen was also at Gateways, not the ICF portion, like the day program portion. I made them come, and it was no big deal. It sounds like it could be a big deal if it's contested, if somebody else is coming forward and saying, I want to be the guardian, and there isn't anyone else, or for me, there wasn't anyone else who wanted that position. Paperwork wise, the big thing was that we had to have an evaluation from her doctor. Any psychiatrist or psychologist, I think it was, like saying that she basically wasn't going to be recovering from her condition. That was basically the legal requirement. So once we got her moved from Mahoning to Cuyahoga, they did ask me to transfer the guardianship to Cuyahoga County, and that was also a pain in the butt. Um, I I don't know what happened there. We must have fallen in some crack. I didn't get a lawyer the second time, and maybe I should have. Maybe that would have moved things along faster. So that was a couple months of like legal back and forth trying to get them to actually process my case. I think the problem in both cases for for the DD board and for the guardianship is that they're not used to doing transfers. They're used to doing like new applications. And so like because it was a transfer, that made the whole process much more difficult. But yeah, long story short, I have the piece of paper. It is important. It has come up in a medical context many, many times. And I don't know.
That was a great answer. I didn't even contemplate the complication of moving from being a guardian in one county to a guardian in another.
It was really confusing actually, because a lot of people were telling me you don't have to bother doing that, like just leave it in Mahoning County, who cares? But the magistrate in Mahoning County really wanted me to. So it was really confusing whether I actually had to or not, and I ended up doing it. Maybe they would have let me stay in Mahoning, I don't know. There is like a guardianship report that you have to fill out once a year. It's not a lot of paperwork. It's basically just, are they still living in the same place? How are they doing? Like, how often do you visit them? Are their needs being met? So it's not a lot of paperwork, but that does come up once a year.
Thank you. And Joan, you were also on this question. Are you guardian?
Yes, but Kat, you just covered
I'm
everything.
sorry.
No, I mean you did, was just perfect. My mom was a horrible procrastinator, and when she turned 90, I finally said, "Mom, listen." I said, "I want to be, I have to be. Let me be your guardian." And it was, everyone agreed that I was the choice. So same thing. I got a lawyer after it was all said and done. I really don't think it was needed, but he went to the hearing, which was real casual. My siblings did all have to sign off that it was okay, obviously, but very easy to do. And maybe that's because the lawyer was doing all behind the scenes things, but yeah, the main thing then is that yearly keep up with those. When you get forms to fill out, make sure you do them. But yeah, it's the same thing. It's kind of just keeping up with them and pretty easy. But I'm not her power of attorney.
Well, you don't need that if you're the guardian.
That's what that I always thought you had to be, but yeah, it was just recently that I found out it wasn't really even a thing. So, but
And
yeah,
that's the thing. I think there are a lot of misconceptions about like what all these things mean and how it all works together. So you're
Mhm.
absolutely right, Debbie. If you are guardian, you don't need power of attorney. Guardianship is like more powerful. The other thing that I have found is like getting in on her paperwork has been kind of a pain in the butt. Like the insurance company didn't want to talk to me at first because they didn't know who I was, so I had to fax the guardianship
Right.
paperwork in. And sometimes like staff at like hospitals and doctors' offices don't really understand how all of this stuff works either. So like they'll ask me if I'm power of attorney and I'll say no, I'm legal guardian, and they just look at me like I don't know what that means. So sometimes I'll just say, yeah, I'm her power of attorney because it's just easier than it is to try to like explain the nuance to people. Um, but yeah, it's like I said, as part of the process of doing this, there was like an online training. And I was kind of like, oh my gosh, this is going to be pointless, but it was actually really, really informative. And it kind of like walks you through what you're signing up for, what the differences are, um, why people would need this. And the thing that stuck with me is like they're trying to come up with the least restrictive solution. Like the state doesn't actually want to get involved in your personal life for the most part. So they basically are trying to come up with a solution that makes the most sense and the one that allows that person to be themselves as much as possible. So that's sort of like the guiding principle behind most of it, I think.
I also want to point out that if your parents die and they put in their will that they want your sibling to go to you, like if I said in my will, I want Jeremy to go to Stephanie and I want Aaron to go to Kia. That doesn't make them the guardian. You still, as a sibling, have to apply for guardianship after your parents pass. I'm guardian of Aaron, but once I die, she has no guardian until one of the children apply, my other children apply for that. So I've heard other people tell me, well, my mom left me my sibling in the will, that I'm the designated person, but the court does not recognize that. Just wanted to point that out. And Wendy, you had your hand up for a minute. Did you have something you wanted to add to that?
I've run into almost the opposite of what you guys were saying. Very good attorney in Cleveland, deals with the trust, especially trust for special needs, et cetera, and said, I wish you would have talked with me because you do not need to have the guardianship as long as you've got the power of attorney. And the
Really?
power of attorney needs to also include medical and health benefit, blah, blah, blah. So you're going to get two different stories there. I happen to have both. I have guardianship and I also have power of attorney. I've also found, like Kat was saying, sometimes you go out to the insurance company or whatever, and they don't like the one set of papers that you've got. So, okay, fine, I'll send you this set because it covers all of that. And then I talked with the Cuyahoga County Probate Court, and once you have your guardianship, it is good for all of Ohio. It has nothing to do with counties. But probably your Mahoning is probably understaffed and overworked, so I get that part of it. So I've kept her in Cuyahoga County. The other thing I think is interesting is Cuyahoga County has put together a separate little program. It's sort of a guardian helpers kind of thing. These are volunteers and they go out to check on the person who is under the court's guardianship, just to make sure that things are going the way everybody's reporting it. I find that is a nice benefit. You don't get to see the report particularly, but they call and get in touch and just, what can you tell us? And in my particular case, they did not go out to Mahoning County to Gateways to look and see. Nancy's in house number 19 on Prestwick, in case you happen to know that much. So the benefit there is that they have 24-hour nurse that's on staff versus other ICFs where they call nurses in. Anyway, I just wanted to add that little bit of information.
Thank you. All right, we're going to move along because we're running out of time, but Courtney and Kat, both your sisters have needed medical attention it's specific to their needs as a person with Down syndrome. So where do you find the resources you're going to need for doctors? Because, what is happening to them may be new, so you don't have a doctor in place for that. Where are you going to get those resources? And Courtney, I think you were first on that one.
Yeah. So Carrie has a large team of doctors, but her primary resource medical professional is Dr. Carl Tyler at the Cleveland Clinic, who has a specialty in individuals with Down syndrome. So he is kind of the point person for a lot of her care. And I don't know, in the past year or so, Kim or I have been trying to go to all of Carrie's medical appointments as much as possible, or being able to review her notes right afterwards, so we can be involved in her care, and providing input to the doctors of what we're seeing, because, reporting her symptoms is not always the easiest thing for her to do. In addition to using Dr. Tyler as a resource, we also have joined some Facebook groups. We are in what is it called? Families of Adults with Down Syndrome. And one place we follow that we find is like really helpful, that has a lot of information, is the Adult Down Syndrome Center, which is in Illinois. And they just provide a lot of information that we find useful. Sometimes we'll read something and say that Carrie was having an issue. And then I had read something about dry mouth, and sure enough, Carrie's got very dry mouth. It's been something she's always had, but we never really thought of it as a major thing. But now it's kind of maybe becoming more of a symptom that's causing some issues. So it just kind of highlights things that maybe we didn't realize were something that were maybe specific to her for having, because she has Down syndrome. And Carrie's favorite question anytime she has a new symptom is this because I have Down syndrome? And we don't always know that answer. So Dr. Tyler helps us with that, and these resources help us with that. And sometimes it actually is helpful that we normalize things for Carrie and say, nope, you're just getting old like the rest of us. But yeah, those are the places where we get information. And Carrie also, she has advanced directives.
Thank you. I was
So
going to ask that.
we have those plans in place. And I think us getting more, and Kim and myself getting more involved in Carrie's medical care is becoming more and more important as, my mom is still very much her caregiver and very much steering the ship, but just so we're helping with the transition of, when my mom needs more help with this process.
That's great. Okay, and then the other person on that question was Kat again. Sorry if I'm working you too hard tonight, Kat.
No. So for me, out in Youngstown, she was just seeing a random doc. It was like a nurse practitioner. This person was very much not qualified. There's a night and day difference between rural healthcare in Ohio and metropolitan healthcare in Ohio. I have learned that firsthand. It is very, very different. So that was actually one of the major motivating factors for why I wanted to move her to Cuyahoga County, was so that I could get her to some specialists and get her to some people who actually might have some idea what's going on. So when I joined DSANEO, actually, I started asking around, like, who do you recommend? Who do you work with? Debbie, I don't know if it was you or somebody else in the group, but somebody pointed me to Dr. Rondinelli at University Hospitals. He is amazing. So he's med peds, which means that he has he's a full MD, but he also has pediatrics training. And I think that really shows because he's able to be more, I don't know, the pediatric approach is just different from the regular medical doctor. I think pediatricians are used to a scenario where the person who is experiencing whatever the problem is can't really explain it, and they're used to having to go to somebody else to make decisions. Whereas like the medical doctors seem very confused by that whole idea in many cases. So his training has been really, really helpful, and he's really been the quarterback for getting her into various different specialties and subspecialties. So right now we do have a team, and it's mostly through university hospitals because that's who he knows. And we're actually going to be going to the Foley Center soon, trying to figure out if what we're experiencing is early onset dementia or not. So I'm very excited about that appointment, but we'll see what the future holds. And I
Just
don't have
that-
advanced directives. That is on my to-do list. That has been low priority. So
I
that
can
is one of the
understand.
things I need to get to, as well as like a special needs trust.
I just want to point out that Dr. Rondinelli had training in people with IDD. He trained under Dr. I forgot his name, Kia. You know the name of the doctor.
Yeah, I know the name. I can't remember it.
Dr. Stayhauer.
Yes, Duhauer. So he trained with people with IDD. So that's what makes him supremely qualified. Plus, he has great bedside manner, and he's young, so he's going to be around for a while. He's very invested in this population. This was not an advertisement for Dr. Rondinelli, but I just wanted to clarify his training.
The thing that really struck me was he talked to Karen first before he talked to me. And I'd never had a medical professional do that before. Like they just didn't know how to interact with her at all. And they realized that they couldn't like she wasn't able to keep up with them, and they just immediately came to me. And he always starts every appointment by asking how she's doing. And that matters. It matters a lot.
Does. Okay, last formal question. You know, all the resources say that as a parent, we should create a letter of intent, a guidebook for siblings to use once we are no longer on the scene. So Courtney and Wendy, did your parents do that? Have your parents, or your mom, in your case, Courtney, does she have that in place? And if not, would you have, and I'm speaking more to you, Wendy, would you have appreciated having something like that? So Courtney, I'm going to start with you.
Yeah, so my mom doesn't, as far as I know. Oh, my mom's texting me right now. Yes, she does have a letter of intent. Yes, we do, in fact. As I said, we talk a lot about everything, but it's good to know it's in writing too.
Thank you. Wendy?
Same kind of thing. Just a lot of conversation. I have two brothers that don't live in Ohio any longer. We always understood Mom and Dad's goal was to put Nancy in independent living. She was in a group home as soon as she started working. And so she was out of the parental home, all those kinds of things. We consulted with my mom when we moved out of COVID, that kind of scenario there, because it was a huge change, and where we're going to go from there. My mother, by the way, is 101 and a half years old, and she doesn't want to see Nancy. She's afraid that she will upset Nancy, but I think it's more that she's afraid that she will be upset in seeing Nancy. But she continues to ask, and I hope you're doing this, and I hope you're doing that. My brothers, as some of the others have commented, we're in cahoots together on anything that we're going to do with Nancy. One of the brothers was here when we toured the Gateway house. My other brother was here to see other things. So I'm not alone in any of this, and I think we are honoring both. My dad has been gone for some 20 years, and what my mother wants with our direction. Kat, I hope your appointment is with Dr. Appleby, because he's the sole super person
Yes.
over there.
Yes, he is. And he was hard to get into.
He is. Make your appointments well in advance. He will do virtuals, by the way. And yes, I thoroughly enjoyed that he talks with Nancy first.
That's
Checks
wonderful.
to see how she's doing, and gauges the responses, et cetera. So that's very important.
Okay, so we have 3 minutes left. And do any of the panelists have anything they want to throw in? I have a page that I'd like to just show you really quickly of resources that are accessible to any of you. If you want to stick around for a few minutes, if you as participants have questions, we will definitely make the time to get your questions heard. But first, the panelists, is there anything we didn't cover that you think we should have covered? All right, well, I'm going to share my screen. This won't take very long, but I want you to see, that's given that I can find it quickly enough. But let's see, where was I here? So these are resources that are currently available that can guide siblings on their way, or whoever takes over the care. This toolkit is online, and it covers services all over for primarily people with Down syndrome that are adults, but also it covers anybody with IDD. And it isn't pointing out necessarily ICFs that are available, but it will covers on topics like Medicaid and SSI and day activities and a variety of things. So you can look at this toolkit and flip over to pages that you might find interesting and helpful. There is the Adult Sibling Toolkit, which is a book that is where a family member would write out all the things that you might need to know when you take over the care of your sibling. So that's in a notebook, and it's could be very helpful. These 3 books were put out by the National Down Syndrome Society, and I have hard copies at the office. So if you want any of these, I think they're very well done, and I can mail them to you through snail mail, actually. And if you want, you can access them online as well. There's also booklets on Down syndrome and Alzheimer's, but I didn't put that on here because I basically was gearing this toward that whole journey, not just that last stage. So they're very new and very helpful. And then this last thing is charting the life course. And charting the life course is being also facilitated by our very own Lori Kowalski. And there is, Lori can explain to you what you need, but it's also putting down on paper the things that you want for your child or your sibling, what you want doctors to see. It's very in-depth. She can give you more information about that. And we're going to have, I'm sure we had in the past, we had a webinar about charting the life course, and we probably will have one in the near future as well. But these are all really, really good resources that I wanted you to be aware of. Okay, now if anyone has any questions, please feel free to ask. Lori, before we even ask questions, did you want to add anything in about charting the life course? I kind of threw you under the bus and just put you up there, but is there anything you want to add about, because I don't think I paraphrased what it does well.
Well, it kind of can be, I don't want to say take the place of a letter of intent, but it kind of can be very similar to a letter of intent. It could be as short or long as you want it to be, and it could be full of whatever information you want it to be. The documents are supposed to be simple and easy to read. Some of them are one-pagers that you could take to the doctor's office or the hospital if needed. That could kind of like be a snapshot of your loved one. But again, we can get as in depth with those, those documents as you want to be. So
thank you for clarifying. I appreciate it.
And I can meet with anybody one-on-one on Zoom. Zoom works really well because I can have the document, up on the screen, and I can fill it in with you and just email it to you, and then you have it forever. And then the documents are fillable too, so you can add to them or take things away, because it's a fluid document. It could change just like our loved ones change all the time, so the document can change along with them.
Thank you.
Debbie, can you send me those resources in an email, like an attachment? Is it a page that you can send me?
Yeah.
Yeah, okay.
I'll send you what I just showed you.
Okay, great. Thank you.
Okay. I'm writing it
I
down.
put one more resource in the chat. It's called Down Syndrome Clinic to You. It's from MGH. I actually heard about this from the DSANEO program. There is a small fee for this. I think the DSANEO will potentially sponsor you for it. But it's been very helpful in terms of additional like health information. So I think, there's sort of this opinion that like a regular physician can be the person who like manages your loved one with Down syndrome's care. But there is a lot of like specialized knowledge involved. So what they're trying to do with that is basically come up with that specialized knowledge and use it as a tool for the primary care physician. So it's really nice. It gives a summary for you as the caregiver and a summary for the primary care physician so that they know things that they can look into. So one of the things that came up for us was something weird about like neck cervical position. And Dr. Montanelli had never heard of it. He was like, that sounds crazy to me. And then he looked at the study and he looked at like the information and he was like, oh, yeah, that kind of does make sense. Okay, we can do that extra test. It turned out to not be that, but it was very helpful to have that extra bit of just medical background. And I think it helped him come in with a little bit more knowledge to the situation. And
Thank
I
you.
also did Charting the Light course for a little bit. Lori, thank you. You sat with me and we did a page of that, and it was really good for me to have when we went to the hospital. I worry a lot about people making prejudgments of what Karen is capable of and what she's not capable of. And having that like sort of one sheet that sort of showed a snapshot of who she is and who she can be at her best, sort of helped me combat like they're seeing her at her worst. So that was extremely helpful for me as a caregiver.
Good, I'm glad. And
Anybody
even if
else?
our loved ones are verbal, not, I mean, you know, if you're in the hospital, things can change quickly and they're really sick or medicated, you know, they may not be able to speak for themselves. So,
Good point.
Debbie, I had a question. Kat mentioned that someone at the DSANEO office gave her a recommendation for a doctor. Is that something that you could do for other specialties as well?
Well, what we do is give names. I gave it personally because I had used
Okay.
that doctor, but from DSANEO, we can give you a list of names of people that have come to our attention, but we don't recommend literally anybody because, you know, everybody has different needs to be met. So, and then the other thing that we often do is we will put it on Facebook on behalf of that family to get what other families think.
Okay.
And it includes specialties. We all have you know, at DSANEO, we, not all, but we have a list of doctors that come highly used. And
Yeah.
so it's
Yeah.
helpful to get the opinions of other parents.
All right. I had great doctors when my daughter was little, and now, like one by one, they've all retired. And now I feel like, I have to start over again.
I know that's so hard. It's so hard when doctors retire, and because they finally know your child the way you want them to. And
Mhm.
yeah,
Mhm.
that's why I pointed out that Dr. Rondinelli was young, because I felt like he'll be
Yeah.
around until I don't need him anymore.
All right.
So,
Thank you.
sure. Any other questions? Well, thank you so much to the panel. I can't thank you enough for everything that you threw into this hour and a half. I just feel like it was quite intense, and you know, as we all said, the future is going to look different for all of us, but it's so helpful to know what to look out for. So thank you for paving that way for us.
Thank you,
And thank
Debbie.
you all who came.
Thank you, panelists.
Thank
Thank you so
you.
much.
Thank
All
you.
right.
Thank you,
Bye-bye.
everyone. Thank
Good
you.
Good night.
Good night.